Hi, good afternoon. My name is Anthony and I'm from the Respiratory Care Department. Before I start, can I ask for your complete name and date of birth, please? Okay, very good. So I'm going to wash my hands first. Hand-based sanitizer. Yes. Would you mind if I'm going to go beside you as I'm going to assess you first and double check your ID band? Can you lean a little bit forward for me, please? And then take a deep breath as I'm going to listen your breath sounds. Inhale deeply. Very good. Very good. Very good. Okay, sounds good. Okay. Take a deep breath again, please. So I'm going to double check your ID band for confirmatory purposes, and then I'm going to check your heart rate for about a minute with your respiratory rate, and also this one is my portable pulse oximetry to check your level of saturation. I'm going to put this one and clip it in your nail bed. Okay, I think we're done taking up your vital signs. So, the reason why I'm here is because the doctor prescribed you a breathing treatment. So, there will be 3 different breathing treatments that I'm going to administer. And then the first one is through nebulizer, which is a small volume nebulizer. And then the medication that I'm going to administer is albuterol or Ventolin. So, this one is it was ordered for every 8 hours, and then the reason why we're given this procedure or breathing treatment is because it would help you relieve from your dyspnea or shortness of breath and open up your airways. Okay, sounds good. So this one is the small volume nebulizer. So inside is the medication that I'm going to administer. So I'm going to use a compressor-based nebulizer, which is in your side already. So in here is the medication. So all you have to do is you just have to put this one inside your mouth with your lips sealed. And then another thing is that when you put this one inside your mouth, do not obstruct this mouthpiece and then put your tongue below into it. Okay? And then once you start breathing, you just have to start and do normal breathing with occasional deep breaths. Sounds good? Okay, so we're going to start. Put this inside your mouthpiece, and then with normal breathing through your mouth and with occasional deep breaths. Okay, very good. Okay, I think we're done already. I'm going to turn off the nebulizer, remove this one, and put this one on the side. And then after that, I'm going to wait for at least a minute before administering the next breathing treatment. So I think we're done waiting already for at least a minute. So the next breathing treatment that I'm going to give you is through inhaler. So this inhaler that the doctor prescribed is named dry powder inhaler. So the medication that I'm going to administer is salmeterol or Servant. So this medication is a controller. So it would help you for your long-term breathing, and also this one would take a little bit more time for your effect, and the doctor ordered this for at least once daily. So this one is the dry powder inhaler. So as you can see, I'm going to twist it, demonstrate this one for you, and then once you twist this one, you can see a click like that, and then that means that it's ready for use. And then before starting it is you have to exhale all your air out, as I'm going to demonstrate in front of you, until you feel your lungs are empty. And then once you exhale all your air out, it should be away from the device, especially if in this kind of inhaler, so that it would not sputter inside. Okay, so after this is you have to put this one inside your mouth with your lips sealed and your tongue underneath it. And then once you put this one inside your mouth, you inhale deep and then hold your breath for at least 10 seconds or as much as you can. Okay, and then once you're done, remove the mouthpiece and exhale normally. Okay, so can we start it now? So I'm going to twist this one inside in behalf of you. That, put this one inside your mouth and then inhale deep. Hold your breath for at least 10 seconds and then remove this and exhale. Okay? So I'm going to wait for at least a minute again. I think we're done waiting for 1 minute. So the next medication, or last medication that I'm going to give is through meter dose inhaler. So it is similar to the previous one, but this one forms in a liquid form because compared to the previous one, which comes with a powder form of inhaler. Okay, so the medication that I'm going to administer is levobuterol or Sopenex. So the doctor ordered three times a day. So this one is the meter dose inhaler. So all you have to do is you have to exhale first all your air out until you feel your lungs are empty, and then you should shake the device for a few seconds like this, and then after that you prime the dose away from you, at least 1 or 2 actuations. And then when you position your hand with this inhaler, you put your index finger in the top, as this will be your guide for pressing the canister, and then your thumb underneath for support. Okay, and then once you, after done shaking and priming the dose, you put this one inside your mouth, and then once you start inhaling, inhale simultaneously together with your inhalation. Press together it with the canister, and then once you're done pressing, hold your breath for at least 10 seconds or as much as you can, and then once you're done, remove the mouthpiece or the meter dose inhaler and exhale normally. Okay, so I'm going to shake the device and then prime the dose at least once or twice, and then I'm going to hold this one for you. Put, as you can see, observe my hand on the top and also below. I'm going to put this one inside your mouth, and then I'm going to count 1 to 3. Okay, 1, 2, 3, and inhale. Hold your breath. At least hold your breath for at least 10 seconds. And then after that, remove the device and exhale normally. Okay? So now that we're done, I'm going to reassess again for checking your vital signs, such as your breath sounds and also your heart rate. Okay, continue. Deep breathing, please. Okay. Need to listen in front again. Then I'm going to listen, check for your heart rate. And also, I'm going to put again the portable pulse oximetry here in your nail bed to double check your level of saturation. So I think we're done checking your heart rate. So another thing, can you inhale deep and cough for me, please? Okay, so I'll just tap on your back to guide, especially if you have secretions, to mobilize it more, percuss it. Okay, so now that I'm done, I'm going to teach you and educate you on how to sanitize or clean the device. So the small volume nebulizer, as you can see in here, you're going to wash it with sterile water. Do not wash it with tap water as it might contaminate. And then do not include when washing or rinsing the tubing, just this device. I mean, you have to remove them separately, and then once you're done rinsing this one, you have to put it aside and let it air dry. Okay? And then the inhaler should be stored in a room temperature, and then it should be positioned upright. Okay? So is there anything else I can do for you? Okay. So I'm going to give you this call light in case if you need some help or if in case of emergency. Just press this call light, and then I'm going to position the side rails. And then I'm going to give you a glass of water here in case if you are thirsty or anything. And then I'll just adjust the room temperature if in case you're feeling cold already. Okay, thank you so much and have a good day.